So this instrument is for the lumbar drain and EVD, external ventricular drain. So first, this is how it's set, and the doctor will order mercury and centimeter is just doctor's preference, and it's kind of a pressure. And so when you off the drain, because when you set this system like mercury 10 centimeter or mercury 10 or centimeter 10, then that way you will not drain too fast or too slow. That's how I understand. So, and then this one is when you do labeling from this light, and you can adjust how high, how low. So that's what this is for that. So I'm going to do a lumbar or EVD external ventricular drain zeroing first. So just follow this one. So first, see, this one is off to patient. This is the patient. It's connected to the patient. So off to patient, and then after that you have to atmosphere open, and then this one is turn to the side. So this is the pattern. So we are reading atmosphere, and then after that you go to monitor, you press 0, and then when you see the 0, you close cap. But then whenever you use 0, you have to use new cap. This one is deadlock, or sometimes it's just blue cap. So you change it to new one, and then now you just this one is the off the this way is off the so this way is off the atmosphere, and then turn back to this way. So this position is a CSF reading. So this patient is off to burette, and this one is off to atmosphere. And now how to labeling the lumbar. Lumbar is labeled to iliac crest, and EVD is external auditory canal. That's how label. And then also when you transfer patient to floor, or when you adjust bed, make sure you off this one to patient. That way you will not get any air, or you will not get any leaking. If you want to double, then also you can clamp from here to off the patient. Now when you are draining fluid, so you follow doctor's order when you drain fluid, because there's this ICP is too high. So according to the doctor's order, when you do a CSF, you have to put this one to transducer. So from here, patient CSF will drain to the burette, and then you can follow the instruction. Do not use alcohol, and it's toxic to a patient who has this system. And then also make sure when you transfer patient to ICU, you make sure you bring back to this light, or you have to exchange the light. And sometimes the patient come up from OR this way, and then also our ICU, they use this way. But sometimes they come out with this extra, this one. Between transducer and between this the system, they have one more here and something like that. And this, before they prepare this whole system, they have to flush with non-preservative normal saline. So if the patient come out this way, we don't need to put new one. But if the patient come out this way, we have to know how to zero this way. So this one is them. Actually, this one is off to patient, and then open this one. So so this area is totally blocked. So they are reading atmosphere, and after you zero, you block, you off to transducer, the atmosphere, and then you close atmosphere, the cap. So this is how you can do zeroing. So if the patient come with this extra one, you can zero from here, or if the patient come out without this instrument, this piece, and then we can just zero from here. So this is a deadlock, or they could blue cap. We have available here. So sometimes when they do zero, they bring down to 0 here in the labeling, but we don't need to do because atmosphere, there's not much there's not much level difference. So we can just zero from, to follow this instruction, we can zero from like that.